A Winnipeg woman is trying to stay positive after a horrible experience at Grace Hospital. Shawna Forester Smith is 41 years old and currently lives in the chronic care unit at Deer Lodge Centre. In 2009, she was diagnosed with gastroparesis and intestinal pseudo-obstruction. It meant vomiting, multiple surgeries, infertility, and tube feeding. Her health condition requires her to take multiple trips to the hospital, but a recent experience at the Grace has her raising concerns about the care she received. And now she's calling on changes to the healthcare system. Shawna, thank you so much for joining us.
Thank you for having me.
You went to Grace Hospital on March 2nd. Can you tell us what happened that day?
March 2nd, I was at Deer Lodge. I started getting progressively ill as the day went on. I was going septic. By about 2 o'clock in the morning, Sunday morning, my blood pressure was dropping dangerously low. I was starting to go into shock. So the decision was made to transfer me to the Grace Hospital because it was no longer safe for me to be cared for at Deer Lodge. So I was taken by ambulance to the Grace, and what I experienced was awful.
Can you talk a little bit about that, what your experience was like?
Yeah, I have been a frequent flyer of the emergency room for over 15 years, and I've never experienced anything like that. Just the workloads of the staff were untenable and unsafe. They were unable to provide competent and basic care. People had way more patients than what was safe or manageable. I was admitted, but there was no bed available. They had no idea when there was going to be a bed available. It was also becoming problematic for me from a treatment perspective, not being able to get a bed, because I rely on intravenous nutrition. I'm unable to eat. Well, they can't do that in the ER. They can only do that on the ward. So I wasn't able to get any nutrition. So I'm fighting a life-threatening infection. I'm not able to get nutrition. I have no idea when I'm going to be able to get nutrition. So eventually, the attending physician and I just decided that even though we didn't even have my blood culture results back, it was probably in my best interest to send me back to Deer Lodge. I don't blame the staff, and I'm not upset with the staff. And I wasn't upset with the staff because it's not their fault. They're trying the best that they can. They're doing the best that they can. The workloads and the working conditions are just terrible and unmanageable and unsafe. And that's why I started this petition.
Can you talk a little bit about that? We only have about 30 seconds left, but I really want to hear about this petition and what you're hoping to accomplish.
The petition is for the government, shared health, and the WRHA. And what I'm asking for is them to address the issues with excessive wait times, to fix the issues with access block, which is patients admitted but with no bed to go to, and to fix the 3 issues pertaining to staff, which include morale and working conditions, workloads, and then addressing the staffing shortages in the ER and issues with retention. If they don't fix those things, it's just going to get worse, and we're going to see wait times get even worse, and more people being harmed and more people dying, because 3 people have already died because of the conditions of our ERs in the past year, and that shouldn't happen.
Shawna, thank you so much for sharing your story. I'm really sorry that you had to go through that, but thank you very much.
Thank you.
A spokesperson for the Winnipeg Regional Health Authority said it's looking to expand staffing at Winnipeg hospitals, as well as working to add 36 additional acute care beds at St. Boniface Hospital and 31 new beds at the Grace.